How does it feel? Doing good?
Yeah.
Was it painful?
Not really.
Not really.
A slight sting.
Yeah, kind of like slides and then basically diminishes after a few minutes. Again, he's frosted up really well. Again, I've had pretty much majority of all those ice pick scars. Again, he does have large pores, and unfortunately it's very difficult to kind of hit all those large pores. But I think he's gonna do really well. I constantly look to make sure I haven't missed much, and to me it seems actually pretty good. Hello, this is Dr. Behnam. Welcome to another session of our TCA Cross episode. We're joined today with one of our lovely patients who has done 2 TCA Crosses in the past for the ice pick scar. TCA Cross was originally described for actually ice pick scars, and he's the ideal candidate for it, but we do use TCA for a lot of other type of scars as well. Today we have our 80% TCA Cross, so TCA chemical peel, so we're going to add a little bit right in here, and we are going to be doing one of the sessions today. Any questions? So you already been through this before. A couple things I always say. There are 2 risks. One, that you could hyperpigment, which always goes away. We typically have patients bleach afterwards. And the other one is basically sometimes patients could get red spots, which always also goes away as well. You're gonna scab out for 7 to 12 days, and tonight you're just gonna wash your face and wear a lot of sunscreen tomorrow morning. This is it. The post-op care is actually very easy, and that's what I love about the TCA Cross. Here we go. So please sit all the way back. Now looking at the skin again, a lot of the deeper ice pick scars have filled in, so I'm very happy actually. So we're gonna go after each individual scar, and we're gonna put a tiny bit of TCA into them. So what's gonna happen is that he's gonna frost up. How are you feeling?
Good.
Is it hurting a lot? It should sting a little bit initially.
It's just sting, nothing painful.
Yeah, it stings for like a few seconds initially. Doing great. Again, I'm gonna go after each one of those ice pick scars. You doing okay?
Yes.
Yeah, you have a little more deeper scars on this side. How does it feel? Doing okay?
Doing good.
Again, guys, we're trying to go after each one of these acne scars and hit them pretty well. I typically have patients come back in 6 weeks and repeat it again. Again, depending on the skin type. If you're lighter skin type, you could do it in a month, in about 4 weeks. If you're a little bit more olive skin tone, I'll have you do it in about 6 weeks. So again, initially TCA was intended for ice pick scars. I practically do it in all of them. Box scar, deep and shallow box scar, ice pick, and some of them are rolling. Although with rolling, you do need to do a subcision to get the ideal results. In your skin color, probably doing a laser session as well, it will help you quite. It will just help you more. He's frosting up really well, guys. I love it. He's gotten more than 30% improvement in 2 sessions. Typically, I like to do several of the TCA sessions before I do the laser. I try to kind of leave the laser towards the end. Again, he has a lot of ice pick scars. This is what basically is ideal for his skin. And I'm going after all of these. Now, do not try this at home. Also, the point is not, the technique is really, really important. You want to make sure that you're not overlapping with other spots as well. So this is more of a isolated treatment of every acne scar, and that's why sometimes it takes a while basically for us to do every spot. Also, there are a lot of physicians, unfortunately, that only do the ice pick scars, which was originally indicated for it, but you could actually do other ones as well. So they only partially treat. You want to do a good treatment so you get the best result possible. On some of the deeper ones, the box scar, you actually want to paint it on. It's called the painting technique. And the ones that are deeper, you want to basically go and basically dab a little bit right into an acne scar. And I also do the nose as well. In the nose, I do a lot of patients on the nose, and I think the nose does respond. Also, another question people always ask, that if I have large pores, can I use a TCA Cross? Yes, it is going to work, but everybody's different and people might have different responses. How does it feel? Doing good?
Yeah.
Was it painful?
Not really.
Not really.
It's a slight sting.
Yeah, kind of like slices and then basically diminishes after a few minutes.
Yep.
Again, he's frosted up really well. Again, I've had pretty much majority of all those ice pick scars. Again, he does have large pores, and unfortunately it's very difficult to kind of hit all those large pores. But I think he's gonna do really well. I constantly look to make sure I haven't missed much, and to me seems actually pretty good. I'm gonna hit a couple more of these other deeper ones here. Turn over this way. Guys, the goal is to hit every spot, at least majority of the spots possible. Did we get them all?
I think so.
Perfect. So again, what he's going to do is that he's going to let this sit till tonight. He's going to wash it tonight. Don't exercise today. Don't wash it off till tonight. Don't put any sunscreen on it right now. You go home, you wash it off. Tomorrow morning, you're going to put sunscreen on it. Stay out of the sun. Don't pick at the scabs. Don't use any acids or anything on your face.
Okay.
Any questions?
No.
Perfect. Great. Guys, thank you so much for joining in. This was another session of the TCA Cross. And we're going to see you in 6 weeks, and we'll kind of retake the photos and we'll go from there. We'll see how you did.
Awesome.
Thank you so much, guys. Thank you. So tell me about your experiences with respect to the improvement of your acne scars after doing the 2 sessions.
Of course. So the first time I did it, I saw visible improvement.
Okay.
It's about like a 20 to 30% improvement the first time. And then the second time, it was again more improvement on the smaller holes that were there.
Okay.
They're pretty much gone.
So would you say, so after 2 sessions, probably what, about 30-ish% improvement, after 30 to 40% improvement? Is that, would you say that's correct?
Definitely.
Okay, perfect. So that's good. That's very good. Did anybody ever mention anything? Did anybody say, "Oh wow, your skin looks better"? I mean, did you get any compliments from anybody?
I did. Someone did tell me that my skin looked better, so that was good to hear.
Okay.
I wasn't the only one noticing it.
Okay, perfect. So that's great. Would you now? Did you have did it hurt a lot?
No.
Was it painful?
No.
Had you done other procedures before, like lasers or anything prior to that?
No.
So that was the first time you did anything for acne scar?
Yes. Correct.
Would you recommend the TCA Cross treatment to other people, or?
I would. It's definitely something you should pursue if you have acne scarring and you want to get better skin or you want to improve on it. Definitely something you should try or do.
Okay, perfect. Okay, so today we're going to be doing another session of the TCA Cross, and we're really going to go after some of the deeper acne scars. And if you look at the photos, you will see that he still has acne scars, but they're just a lot of just like smaller ones have kind of like gotten a lot better, or it really disappeared. But I think overall you do significantly look a lot better.